Fred is the founder of NewsWeb and president of the Alphawood Foundation. His media and print companies have supported causes critical to the LGBT community. And as a civil rights and peace activist, Fred's work has affected Chicago and the nation for over 40 years. His work has also deeply affected me. When I was 20 years old, I first met Fred. At the time, he was on the board of the AIDS Foundation of Chicago, where I had recently started in an entry-level role as administrative assistant. I answered the phones, refilled the coffee, made board packets, you know. In the early days of the AIDS pandemic, I witnessed Fred and his board colleagues navigate and respond to the very new threat of HIV/AIDS by leading efforts to develop a more robust infrastructure to fight the disease. It was eye-opening for me and taught me lessons that continue to drive my leadership today. Fred is a generous philanthropist whose support of LGBTQ and HIV organizations, art institutions, public spaces, and historic preservation are creating vital change in the nation and locally. He's also a prodigious political fundraiser, supporting progressive candidates for office whose voices and views have been decisive in advancing a more equitable, just, and humane society. Through his foundation, Alphawood, Fred has been critical in creating important LGBTQ infrastructure and cultivating fundamental social change. Alphawood has supported HowlRound HIV services for many years and has given critical support to other organizations in our community like AIDS Foundation, About Face Theater, Test Positive Aware, Equality Illinois, Pride Action Tank, Women Employed, Illinois Coalition for Immigrant and Refugee Rights, and so many more. Over many years of grant making, Alphawood has advanced justice, supported the arts, and addressed many new challenges facing our community. Tonight we honor Fred not only for his leadership in the fight against HIV/AIDS, not only for his powerful role in making our country a safer, better place for the LGBT community, but for his visionary philanthropy and advocacy that will continue to benefit generations of LGBT folk long into the future. It is my distinct honor to present Fred with the Friend for Life Award.
Thank you so much for that. You bring back those days at the AIDS Foundation 32 years ago, and we've been at this a long time. I think that period of the AIDS Foundation in the very early 90s was a transition from a strictly volunteer-run organization led by very dedicated people directly affected by the disease, working into a more professional organization. And so I think you're more professional managed organization. So I think your experience there is serving you in good stead at Howard Brown as you build this great organization. And I personally wish you wisdom and courage in all the things that you'll confront in the next couple of years. David mentioned political philanthropy as well, which I practice from time to time, and I don't think we're going to be political tonight, but the personal is political and we can't avoid it at all times. So I think the most amazing thing is that we're all here together tonight. 2 years ago we went into lockdown, and isn't it wonderful to be back together? I've seen so many old friends and so many new friends. Thank you for your generosity. I think all of your speakers tonight are going to comment on the fact that Howard Brown was started in 1974, only 5 years after Stonewall, by a group of gay medical students, one of whom I slept with actually way back then. was having trouble coming up with a laugh line tonight, and that just happens to Oh my God. I think the most amazing thing about Howard Brown, though, was the idea that queer people could come together to respond to the health needs of other queer people, and it was a radical idea at that time. We were demonized by the health system. Our national health system at large called us sick and mentally ill. We were listed on one of the mental health charts as distended and distorted and a bunch of other disses, but solely because we were gay. And so the miracle about Howard Brown is that we, the marginalized and the maligned, took charge of our own health care and took care of our own people, and we're all here tonight because of that. And when we got gonorrhea or chlamydia or syphilis or crabs, Howard Brown was there for us. The tragedy of AIDS emerged, and Howard Brown was again there for us as we struggled in the face of an overwhelming epidemic and incredible hostility from the government, most government actors, with little or no government response, frequent discrimination, and no public health response to speak of. Famed conservative, am I yelling too much at this? I've got my hearing aids. Okay. Famed conservative, so-called intellectual William F. Buckley suggested that we should all have our AIDS status tattooed on our forearms so that other people could be protected from our threats. Republican President Ronald Reagan could not even say the word gay-related immune deficiency. He couldn't say AIDS, he couldn't say HIV. Instead, they demonized us and blamed us for what was going on. Our friends started to die. I was going to name a bunch of people tonight, and I have to let that go by because we've done public naming many times in the past. But our friends started dying, horrible, horrible deaths. We saw formerly handsome young gay men on Broadway and Halsted, hobbling along on canes and walkers, emaciated bodies, faces covered with carposis sarcoma lesions. We had many internal fights in the community. There was so much stress and there was so much pain and so much anger. We factionalized, we fought like dogs, but ultimately we came together, largely came together, and much of that turmoil over the years has led to where Howard Brown is today, the wonderful organization that it's become. But even after the horror of AIDS, when the whole world should have learned a lesson, we're here today in 2022 with another epidemic. And more than 960,000 Americans dead of COVID. Our previous president completely lacked any concerted, rational public health policy to address that challenge. He announced the epidemic was under control when we had 15 documented cases on the West Coast. Death from COVID, I would argue, became a private experience, unlike the experience of AIDS, unlike the Vietnam War, unlike the Civil Rights Movement. With COVID, we put the sick behind ICU glass walls, isolated them from their family, and that intimacy that, I'm going to start breaking up about this, the intimacy that occurred with AIDS wasn't there with COVID. And that may explain why we have not had a rational public citizens response to the COVID epidemic. Some of the dying, and I have friends in this room who've worked in the COVID wards, and many of the rest of you have worked elsewhere in the healthcare system. So many of the dead didn't admit what they were dying of. They still said it was a political stunt to embarrass the last president. They denied the science, demeaned the medical physicians, medical personnel that were working working on it. And I guess the thing that's most frustrating tonight, as David mentioned, transgendered youth in Texas. There are people with power in this country who wallow in their ignorance and proudly display their prejudices. And we are once again becoming the target of their ignorance and their prejudice of their hatred. Think of the Republican governors of Florida and Texas.
Boo!
Mocking those of us who still wear masks, ignoring the epidemic, and instead persecuting trans youth and their parents and families and our other LGBT youth. It's just extraordinary in 2022 that we have 960,000 dead Americans. And thank you for all you have done to try to alleviate their pain and suffering. I think we want to reaffirm our support for our medical care workers tonight of all sorts and all institutions. We know you're exhausted, and we know the institutions you work with are exhausted, and thank you so much for still caring. Tonight, I would say, I'm sorry, I'm off my text here, obviously, I apologize for that. Tonight, with so many challenges facing us all around the country and around the globe, we have to ask again, as I have in another speech, which side are we really on? Are we on the side of those who deny and demean science, who turn our national discourse into one big continuous lie, who favor autocracy over democracy, and whose concept of freedom is the freedom to actively hurt other people? The community level work of Howard Brown is essential to moving this country forward. Expanding access to medical care, to health information is essential. Making HIV treatments and prophylactics available to all people, regardless of your race, color, or zip code, is essential. Supporting our young people in a truly volatile time in our society is absolutely essential. They're going through unbelievable stresses that those of us who've been at this somewhat longer may not even realize the extent of what they have to go through these days. So reaching out to our young people. And in spite of people who would tear us apart and divide us, we need to continue building coalitions with communities and groups and other stakeholders across the entire city, all parts of the city. Is absolutely essential. Thank you also very much for being here tonight. Thank you for your wonderful generosity and for all the good you do in all parts of your life. It is really amazing. Howard Brown is essential, and each and every one of you is essential. Thank you.